With that said, speaking in of which the pandemic, we're going to share. Tomas is going to present on public policy, and he is a research scientist. So we're going to move on to the next talk.
1918 to 1920 flu. Hi everyone, it's great to be a part of this Passion Talk session. My name is Tomas Leon, and today I'll be talking about after a pandemic, what comes next for public health. I needn't tell you that we're in the midst of the COVID-19 pandemic. We've all lived through it for a year and a half or more, and it's really an event without precedent in our lifetimes. The most recent similar event being about a century ago with the 1918 to 1920 flu pandemic, with similar numbers of infections and deaths, and really changing the course of history after World War I. Yet, I would be remiss not to mention that over the last several decades, we've had several other epidemics and pandemics that have affected a lot of people and a lot of countries around the world, from diseases such as HIV/AIDS, Ebola, measles, cholera, and SARS. So just to point out that going forward, even after COVID-19, there will be many diseases to prevent and to control. But of course, today I'm focusing on COVID-19. And since I live in the state of California and work for the state of California, just to point out some of our numbers, not to go into detail, but to say we've had numerous waves of cases and deaths. We're currently in a new one related to Delta. And if we zoom out and look at other geographical units, nationwide, we know that this is happening too, with a large number of cases across the US. And looking at this slide and zooming out, we can really see that the pandemic continues and that it's far from over worldwide. So the good news is throughout the pandemic, we've had a number of success stories that we can point to, a major one being vaccine development. The development of the COVID-19 vaccines really happened at an unprecedented pace, with the first shots in arms in less than a year from when we had first sequenced the virus, and really coming together because of a massive collaboration between government, academia, and industry. And fighting COVID-19 really required coordination at multiple scales across cities, counties, states, and nations. And there was a lot of knowledge and resource transfer that happened across borders and between different people and groups. Now, certainly there are also a lot of shortcomings and a way in which coordination, collaboration, and communication broke down. But we should also realize that this was a massively disruptive event. And so a lot did go right and has gone right, even as the toll has been severe. There's also been a lot of great basic science that has helped our fight against COVID-19. One I just want to mention in particular is genomic epidemiology, which is basically using sequencing to look at virus and transmission of COVID and the spread of variants to better understand risks and contact tracing and other aspects that help us understand disease transmission. Now, there have also been a lot of major challenges. One is that trust in institutions is low and has been decreasing recently. There's been a lot of vaccine hesitancy, a lot of misinformation on the internet and social media about what vaccines are and how they work. And part of this has to do with the fact that people do not have great relationships with their governments, do not trust pharmaceutical companies, may not trust other people. And this has been a major barrier. Another kind of reasonable issue and question that people ask is, does WHO or CDC or my health department do a good job? Are they acting in my community's best interests? And it's worth pointing out that for a lot of communities, this may not be the case. There may be history of discrimination or fraud or abuse. And so there's a real need to regain the trust of the public and to increase trust in public health institutions. Another challenge, of course, is health equity. The burden of pandemics has always fallen on the poor and is disproportionately borne by the poor, whether they live in a rich country like the United States or in poor countries around the world. And this manifests in things like vaccine access, testing access, the ability to evade exposure to pathogens, such as being able to work from home or living in uncrowded housing, having access to masks and different supplies. All these things are related to health equity And certainly there's a ton of progress that needs to be made locally and worldwide in terms of distributing the benefits of our society and the ability to live a healthful life.
I want to spend a little time talking about California's data to make the point that even with an emphasis on health equity, significant disparities remain in this pandemic and more generally. So the state of California cares a lot and puts a lot of emphasis on health equity, and yet disparities remain. For example, death rates for Latinos are 21% higher than statewide. Case rates are higher for Pacific Islanders by 38%. Death rates for Black people are 10% higher than statewide. And case rates for poor communities are 35% higher than statewide. The plot above shows test positivity, which is the percentage of tests that show a positive COVID diagnosis. And the black line is statewide, and the blue line looks at geographical areas that are at risk for poor health outcomes and shows a consistent disparity across time. This was also evident in our vaccination rollout. So this shows vaccine rollout by something called the Healthy Places Index that we work with a lot. And this is a way of scoring counties and census tracts and zip codes by healthfulness and by access to the opportunity to have good health and to live in a healthy place. So green line is the healthiest zip codes, and blue is the least healthy, or the zip codes with the least opportunity for good health. And you can see that throughout the vaccine rollout, the disparity started early and continued and has widened, frankly. Some of this is related to access, so the ability to get vaccinated. Some of it is related to trust, too, which we've touched on. And to point out that some of these communities have been neglected by the public health system and do not trust vaccinations. And so the state of California and the country and the world writ large is trying to increase confidence on this thing. But even with this emphasis, it takes a lot of work to be for health equity and to work for the whole community.
Another lesson that has come up in recent pandemic responses is that globalization and connectivity are here to stay, but expose weaknesses. So this has been seen in a lot of different ways. A couple I just want to point out is the Tokyo Olympics, which were first delayed and then happened this year. But for those of you who watched, notice that they looked very different. Some athletes were disqualified for having a positive test. There was masks seen. Spectators were mostly kept away from events. And at the same time, when we look back at something like Rio Olympics and Zika, we see the potential for these large international events to spread disease and to require a lot of coordination around disease control and prevention. There's also the fact of the economy, in that when the pandemic shut down international travel, this affected supply chains, this affected business, this affected families, and the economy took a really big hit around the world. And it has recovered a fair bit since then, but for many countries' economies, there's still a long way to go, and it's hard to say how long it'll take to recover. If we look at different countries like New Zealand and Australia, or China and the United States, each had different opportunities and challenges in their responses because of their geography, because of their governments, because of culture. And all of these kind of, again, expose that connectivity is really kind of a feature of our society, but something we certainly need to take into account for pandemic response. So what did we learn? This is a short talk, so I just want to touch on a couple points. One is something that I just mentioned, which is that countering global pandemics really requires global cooperation. And some things went well and some things did not go well. And going forward, no matter how imperfect our international bodies are, like the WHO and the UN, we need to continue to increase cooperation and sharing and ways to maximize health for people all around the world. The other thing is that even with successful vaccine development, the pandemic continues. We may have started vaccinating people last December in the US, but here we have another wave of cases. And frankly, we probably have at least another year to go in this pandemic. So to deal with that, we need to address some of these vaccine hesitancy, misinformation issues. We need to think about safety. We need to think about other kind of public health responses to supplement vaccines. And the question always comes up, will future pandemics be worse? And the truth is potentially, in that COVID-19 is highly transmissible and it is fatal, but there are more fatal pathogens. And so it's possible that we could get a highly transmissible and a highly fatal pathogen, and we need to be prepared for that. I would also add that on a government level, prevention and preparedness are not easy to fund. We tend to build up capacity and then lose it because years pass and the emergency or the crisis doesn't happen, and then we lose the people who worked on it and the supplies and resources we built up to deal with things like pandemics. So we need to think in the long term, and we need to maintain and build up capacity to be prepared for these future events and contingencies. So what's next? Well, I want to touch on just a couple different levels. One is that at the government level, we should really focus on investing in and increasing public health capacity internally and through collaboration and improving disease surveillance. And by that, I mean being able to track disease, be able to see what's happening, to have good data on it, and to have the systems to kind of share that data. In academia, there's a lot of exciting biotech development that can continue, and that can work on other research for developing early warning systems for pandemics and outbreaks, and also look at novel approaches for disease prevention and control. On the industry side, they should continue to leverage partnerships to incentivize development of vaccines and therapeutics and to commercialize them against the wide array of diseases that will continue to circulate after this pandemic. And also to leverage new research and technologies for flexible approaches like the mRNA platform to really help us prepare for future pandemics and future diseases that will emerge. At the community level, kind of a reflection I have is that loving your neighbor, the second greatest commandment, has really been apparent during this pandemic. And this is manifested through things like mutual aid societies, through vaccine diplomacy, by which I mean sharing vaccines across borders, social safety nets, and different legislation that has helped people stay afloat out of poverty in their housing. And a question we should really continue to ask ourselves in our communities is who we can help and support in our spheres of influence. We need to recognize that the pandemic is not over. It may be discouraging, and at times it may feel over for you, but it continues around the world, and we need to kind of lean into this reality rather than to kind of pull the wool over our eyes, as painful as it may be. To kind of wrap up, I want to kind of address this at a personal level, and a lot of these questions don't have good answers. So why do evil and suffering exist? This is a big question beyond the scope of one passion talk, but it's something we have to continue to wrestle with. We've had a lot of suffering in the last year and a half, and there's more to come, frankly. And there's a lot of discouragement right now as Delta has ramped up, as it's created new waves that we thought would be turned back by vaccination. The disease continues to surprise us and evolve, and we have to continue to adapt. But we should also remember that this too shall pass, and that we should look not to things that are seen, but to things that are unseen, for the things that are unseen are eternal. And keeping that perspective in our faith traditions and our beliefs will help us be encouraged for what is to come. I also want to kind of circle back to the WHO definition of health, which is a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. It's really easy to focus on COVID-19. It's easy to focus on diseases, and in a way we should. But we should also focus on health, and this is to point out that health is not merely not having disease, but it's well-being and flourishing. And to the degree that we can encourage each other, that we can build community, that we can build trust, that we can help others, this will create health and well-being around the world. And what I've learned from my experience during the pandemic is there's a lot of people working really hard on these issues, working in their communities, and not necessarily being recognized, but building health and preventing disease. And I'm really inspired by that. So going forward, I hope you take these lessons to heart and that you are encouraged even when things seem rough and when there's suffering around. So thank you. I'm glad to be a part of Passion Talks, and I hope that this shares my passion for public health and for improving health in the state of California and around the world. Thank you.
Awesome. So we want to open up time for everyone. So we'll turn on cameras, and I'm really appreciative for Tomas and sharing his experiences, because I've basically had, like, you answered like a dozen of questions that I've had about the global pandemic. So let's open it up for people to comment or have questions to Tomas. I can start. We have a question that is about how faith-based communities can engage with the solutions to help make this. I mean, it's hard on everybody, right? And so a lot of people don't like what is our day-to-day lives. So what are ways that these communities can help, and ways we can, like, contribute to something that works for everyone?
Yeah, I think that's a great question. And I think actually from Juanita's Q&A, I think a really great point came up, which is kind of how God is using scientists and using science. And I think beyond that, even, I think it's important to recognize that there's, faithful believers in all occupations and in all parts of society. And so part of it is just talking to each other and speaking from our areas of expertise and what we work on. And so within, our spheres of influence within our faith communities, talking to each other about, these areas, whether it's COVID, whether it's homelessness, whether it's all these other big picture issues, and kind of speaking with our common foundation, I think is really one place to start communicating internally. And then I think speaking out to, I kind of talked about loving your neighbor and kind of living in hope amidst kind of uncertainty and confusion. I think those are a couple ways that faith communities can, I think, make a difference amongst themselves and also kind of, again, in their communities.
Tomas, I really appreciated your talk, and I was wondering, lessons learned, can we, like you said, there's going to be other health issues, public health threats. Do you see that we could take what we've learned and act more quickly, knowing that there probably will be health equities? Just maybe assuming that and trying to do things more quickly the next time?
Yeah, that's a great question. And I think it really takes having that health equity lens on our whole approach to public health. If we don't take it into account, then it just falls by the wayside, and people that are neglected or otherwise are going to have worse health outcomes. That's just what's going to happen. And so I think realizing that and being very intentional from the start, and pandemic response, or even things like flu vaccination or nutrition campaigns, all of it, if you start with a health equity lens and that intentionality, I think that it's going to be better for the whole society. But you have to start from the beginning.
Thank you so much. I have a quick one. Were you surprised, or were you like, this is something that you've been studying and you just knew that it was bound to happen?
Yeah, I think it's a bit of both. I think others like Juanita would probably say we're always sitting on these ticking time bombs of like what we call zoonotic spillover for these diseases to appear and pandemics to happen. And with 100 years passing, it did kind of feel like it was time. At the same time, SARS-CoV-2 has kind of different characteristics. And so the way it's played out has been kind of different than past pandemics. And so in that way, it's been surprising. And with each new wave, we kind of hope it's over, and then it's not. So a little of both, and more surprising than I think any of us would like it to be.
Yeah. Thank you so much for your work, Tomas. Keep trying to keep the world safe.